Well, did you know that oral health and a good night's sleep are more connected than you might think? And if you're someone who maybe struggles with falling asleep, staying asleep, or has already been diagnosed with a sleep disorder, Napa Family Dental, they want to help. So they are here sharing with us how to address these problems and avoid more serious health issues is the owner of Napa Family Dental, Dr. Kartik Antani. Doctor, thank you for being here today.
Thank you for having me.
So I would not necessarily think that sleep and dentistry correlate, but they do. And so that's kind of going to be the focus of today's conversation. And I want to start things off by asking you about what obstructive sleep apnea is and how this affects your health overall.
So obstructive sleep apnea is one of many sleep disorders which are always diagnosed by a board-certified licensed sleep physician. And in this case, in particular with obstructive sleep apnea, folks who suffer from this are having partial or complete closure of their airway. So they're not able to get the oxygen in where they need it. And that, of course, affects their heart rate, that affects their chances of having a stroke as they get older, affects even people who are trying to lose weight.
Okay.
It affects your energy levels, it can affect your mood. Basically, when you are not getting enough oxygen, your body has to compensate for that. One common way is for it to pump you harder, and so people wake up feeling tired, like they just ran a marathon.
Yeah.
They have low energy throughout the day, and they, of course, grind their teeth and have jaw issues as well, which is what we see often.
This feels very counterintuitive, right? You wake up feeling more tired than maybe when you went to bed. What are some signs people should be on the lookout for?
So a common sign is snoring. So whether they themselves notice it or a bed partner, snoring is a common sign, but it's not just the only sign. Choking, gasping, waking up, breathing improperly. When you wake up in the morning, if you're feeling very tired, if you're tired throughout the day, that 3 o'clock slump and you just want to go to bed.
Yeah.
Elevated heart rate, you wake up feeling not so great, are some signs. Dentally speaking, we notice some specific patterns of wear and tear on their teeth. We notice jaw issues like clicking, popping, pain, difficulty of moving the jaw. That can all be part of obstructive sleep apnea. And of course, when we see the patient, we notice that their tongue might not be fitting correctly, or the airway is obstructed, or the jaw is too small, tongue is tied. All these little clues tell the providers that there may be something else going on with their overall health.
Absolutely. I do want to ask kind of, why dentists care about obstructive sleep apnea.
Well, we care because, first of all, the ADA recommends that we screen our patients for sleep apnea. But more than that, we care because we have to try to find the root cause of what's causing their teeth to break or grinding, or why are they feeling tired all the time. We have to try to find the root cause of why their jaw clicks and pops or causes them discomfort, whether they can't open properly or can't chew properly without it hurting. And sometimes asymptomatic. They may have clicking and popping forever, but they don't have any pain. So we have to try to find those clues, and we have to identify obstructive sleep apnea as a possible cause of these issues. And that's why it's important. Absolutely.
Well, yeah, if you wake up and your jaw is hurting and you're grinding your teeth and you're maybe not even realizing it, this is where you guys can come in and help. What therapies are there? How can, dentists help with sleep apnea and jaw pain, stuff like that?
So obstructive sleep apnea is a small part of a big sleep community. And like I said before, only a licensed board-certified sleep physician can diagnose that. And based on the findings, that's where the therapies come in. It can be a CPAP, which is very common, and it works well. If that's something that a patient can use, and there are dental devices you can use, there's myofunctional therapy, there's lifestyle modifications, there is surgery, there Inspire. So there's many different things patients who are suffering from obstructive sleep apnea can use, but it all comes down to the diagnosis and the recommendation by the sleep physicians, and then teamwork from there on with different providers.
Absolutely. How at Napa Family Dental are you guys specifically maybe helping some of your patients who are dealing with this?
Yeah, so if we are prescribed a patient who has obstructive sleep apnea, we can make them a dental device that can help them reduce their apnea. And of course, as a result of that, snoring, right? Make them feel better, help keep their teeth in check. And as a positive effect of that, sometimes it even stabilizes the jaw, gets rid of jaw pain, clicking, popping. Not always, but if that's the concern, if that's the cause of the jaw issues, then it can help. There's also myofunctional therapy and a few other things that can be done in the dental realm. And so depending on the diagnosis, depending on the prescription from the sleep physicians, we can proceed.
Absolutely amazing that you guys are able to give people a better night's sleep through the dental work that you do, more or less.
It's pretty amazing.
Yeah, that's absolutely incredible. How do people go online to learn a little bit more about you and your practice and everything we talked about today?
So they can always go online to napadentalabq.com or newmexicosleeptmj.com. And if they're just curious about sleep issues altogether, it doesn't always have to be specifically to my practice or this region. They can go to the AASM, which is the American Academy of Sleep Medicine. They can learn a lot there. And they can also go to American Academy of Dental Sleep Medicine, AADSM, where as a patient, there are a lot of resources you can pick up on.
A lot of wonderful resources out there for people to learn a little bit more. Dr. Kartik Antani, thank you for being here today.
Thank you for having me.
Absolutely, guys. For more information on everything we just talked about, please head over to krqe.com and click on the New Mexico Living tab.